are watching the Jennylyn show, and I'm Jennylyn, Gleave, your host. And today I'm going to be speaking with Dominik Lysek from the company Credentis, and he's here to tell us about his product called Curodont. And if you are someone who is fearful of going to the dentist, after listening to him, you may have a different perspective about the treatment and the care of your teeth. Dr. Lysek, thank you so much for being here today.
Thank you for having me, Jenny. It's a pleasure.
I was excited when I learned about Credentis and I heard about Curodont, and so I thought it would be great if I could have you come and share the great news with me and my viewers.
I'll be happy to do that.
Thank you. So, would you tell us a little bit about Curodont?
Yes, I'd love to. Well, Curodont really, it works on the basis that the oral cavity regenerates teeth already. So generally, if you think about a tooth, you eat one, you might have seen in commercials, the pH dropping down when you eat something.
Right.
And then the tooth structure, the enamel or the dentin, is slightly dissolved by that acid.
Yes.
And the oral cavity, the saliva, can regenerate that. It does that every day. The problem is if there is too much acid coming from bacteria or coming from consumption of acidic drinks, then there is a point when saliva cannot regenerate that. And we found a way of supplying a scaffold so that saliva can regenerate larger lesions. Lesion being the precursor of a cavity.
Okay.
So all that happens underneath the surface of the tooth, what you see, and it's not that big black hole we're talking about, it's the white spot.
Aha. So are stem cells involved in this in any way?
No, actually enamel is one of the two tissues in the body that don't have any cells left. The other one actually being nails.
Fingernails.
Fingernails, toenails. So cells don't really help us because they don't have any blood supply, they don't get any nutrition because there are no cells in enamel. Actually, when enamel is formed, you have amylogenin, which is a protein, a self-assembling protein,
yes,
which makes sure that the enamel crystals are formed the way that they are. And as a very last step, those amylogenin nanospheres or self-assembling nanospheres are degraded.
Okay.
So they're moved out. That's why enamel is so hard. It's 90-odd% mineral, and nothing else is really much left in there, and also no cells. So cells don't help us with enamel or teeth in general.
Well, thank you. How is the Curodont applied, administered?
It's actually very easy. So in the end, it's a liquid.
Okay.
Nothing else. It's a watery liquid. It looks like a drop of water. Like
really?
So it's not much more than that. You have material which has a monomeric peptide, very short peptide,
yes,
which can diffuse into the subsurface lesion that I've explained just before. And in there it forms this three-dimensional scaffold. It self-assembles, that's
yes,
the name self-assembling peptide, that's where it comes from. Within that subsurface region it self-assembles to give a scaffold. And that scaffold then starts to attract minerals and remineralizes the tooth. So the actual application is absolutely trivial.
Amazing. So from the time a patient first comes to see the dentist, what happens? I come in to see my dentist and I have a cavity, or he sees that there's potentially one developing. What happens?
There are two stories. If it is a
Okay.
cavity, you'll need to endure the drilling. We don't work with actual cavities because that means that top layer has really degraded. So it's very important that you go to your dentist on a regular basis or to your dental hygienist so that they detect caries during its progression.
Right.
So let's say the dentist, he sees, there is something developing. He might put a fluoride varnish on it. He tries to stop the progression with that.
Right.
It's very effective on that. And he just hopes that it never gets to that cavitation stage where you then would have to drill. With Curodont, he would have to clean the tooth properly, first the same way as a dental hygienist does it, and then a very minor chemical cleaning, things that dentists do all the time actually. And then he will put the Curodont on top of that. He will wait 5 minutes, that's the actual treatment.
Yes.
But you won't see a difference straight away.
Okay.
You know, if you see your white spot anyway.
Right.
But you won't see the difference. That takes about a month because nature doesn't work fast. And we're really supplying something for saliva to do its work. Saliva works really slow. So it takes about a month to then really stop and reverse the active caries that you might have had.
So this, for some reason, I was under the impression it was one of the ways that you could treat a cavity. So it doesn't. Basically, what you're saying is that it doesn't.
No, it's if you see at the progression of caries, you start off with something that is, you know, the biofilm that we all have in there, and then you have this kind of demineralization, remineralization equilibrium. If that comes out of how do you say that? If it gets out of the equilibrium and the demineralization is favored, then caries starts to occur. And that is a long time, you know, that can take years until cavitation actually happens.
Right.
So you have a good time to actually catch the caries during that time. We have to differentiate a little bit between what is cavity in colloquial English.
Right.
And that very often might be a white spot, you know, because people talk about, you know, I have a cavity and I get a filling. But it's not black and white. It's a progressive disease which at one point will cavitate. And then you really have a bigger defect. And there, unfortunately, that's then too late for Curodont. Curodont works
in the early stages.
In early stages where fluoride doesn't quite do the job anymore. We know that fluoride might be able to arrest it, but fluoride only works on the surface.
Okay.
It doesn't penetrate very deeply into the tooth. So anything that is underneath that surface will just stay. And that is a successful treatment today, meaning that we don't go to the cavitation stage, we don't need a filling. And then we have further up the line, when cavitation has occurred, we have restorative materials, you know, all the resins, all the fillers. But in between there's really something like a blind spot. There is nothing we can do at the moment. And Curodont really serves that blind spot so that we give dentists something to really help you for your teeth, really gives you an additional benefit, but it also solves a problem for them because at the present they don't know what to do with that.
So then am I correct in assuming that your product would work best on someone who starts off from childhood going to the dentist after they've replaced their baby teeth? Because then you can keep a close eye on what's going on with the teeth.
Exactly. It's very important that you do go for your regular checkups.
Okay.
If you don't do that, you go to the dentist and it hurts. You know, that cavity is enormous and that tooth might not be rescuable.
Too late for Curodont.
Exactly. It's for the people who have, you know, who go regularly to their dentist, where the dentist can identify those early caries in a stage where they can treat it with Curodont. And it also, you know, you mentioned before the people that are afraid of dentists, and you know, I know many of them, and I don't like the drill either. You know, many of those don't like going to the dentist because they're afraid of the drill. This is an additional incentive for them to really go to those regular checkups, to have the possibility, if there is something developing, there is a different treatment to drilling and filling.
And I think so many people, apart from being afraid of the drilling, are more afraid of the shots.
Yes.
So if they have to have a procedure then, the shots that are given to numb the area that's being treated. So if you can avoid having a cavity, you don't have to have the injection as well as you don't have to have the drilling.
Exactly.
For someone in their late adult life, how does your product help them?
Well, it helps the same way as younger people, really. You have, caries is dominant in, say, teenage years, of course. So many of the patients that will benefit from Curodont will be in their teenage years or, early 20s. But nevertheless, if you as an adult
Yes.
develop caries, that's fantastic. Secondly, there is something evolving at the moment, calling root caries. Teeth stay with the people for longer. 50 years ago, your grandparents probably all had false teeth. Your parents, they wouldn't accept those anymore, and we certainly don't do that either anymore. So the teeth stay in the body twice as long as they have done before.
Right.
So what happens is that the gingiva, there is recession, and the dentin, the root of the tooth, becomes visible. And dentin is also susceptible to caries.
Right.
It's actually a little bit softer, so it might even be a little bit more susceptible for that. And the older people, they might not be as good with their oral hygiene. They are not good in brushing all areas of the tooth, and root caries starts to evolve. And for these kind of patients, especially the elderly,
Yes.
the people in care, and dental implant might not be a good solution because there are other problems that come with it, things like peri-implantitis. So keeping the tooth in place as long as possible is still the best option. And with Curodont, we might not be able to heal a tooth that is highly affected by root caries, but we might be able to have it in place for another 5 years. And that, of course, is a big benefit
Right.
for the people that suffer from it.
Right. So instead of curing, you can preserve.
Yes, exactly. There's always you see, what we do is we support saliva to do its work as well as possible. So if the whole environment is caries friendly, there is a high risk of caries, don't expect miracles in that, okay, I don't have to brush my teeth anymore, I can drink all kind of acidic drinks, I can eat lots of sugar, and then nothing will happen.
Right.
That's not the case.
Right.
It's like if you heal any kind of other tissue, you have to preserve it. At the end, you have to take care of it. And that's really what you have to do of your teeth as well.
Okay.
So we give Curodont gives it a second chance. What it doesn't do is it doesn't substitute oral hygiene. It gives you a good chance. But if oral hygiene is in place, then you might be able
So it's
to
not
preserve.
it's not a magic worker. So then here's a question that popped into my head while you were speaking. For someone with periodontal disease, how is your product able to help that person, or can it not, or can it?
Well, with periodontal disease, in very many cases, those people don't have caries. It seems.
Gums.
Yeah, they have gum, they have recession.
Right.
And this Curodont doesn't really help them at the
Okay.
moment. We're trying, and a long shot, to evolve the technology to also develop products for that. But we're still quite far away from that. If they have this kind of root caries that I explained to you before, yes, we can do something for the root caries. But also the bugs that cause periodontal disease and the bugs that secrete the acid that cause caries, those are different bugs. So
Okay.
we don't act on the bugs, but they kind of exclude each other.
Yes.
Not in all patients, but in many patients.
So, based on everything I'm hearing from you, Curodont enables your enamel, it enables regrowth of enamel. Am I correct in
On a
saying
very
that?
small scale, yes.
Well, interestingly enough, on my way here to New York to do this interview, I was watching a show on the plane, and I saw a product that came out that was being advertised, and I wrote it down. I'm so sorry, it's in my hotel room, but basically their claim was, since enamel cannot be regrown, this product is what you needed to use, and I wish I could recall what it is. And I've seen several other products where the claim has been made that enamel cannot regrow. What do you say to that? Based on the fact that you've used the product, that you have the evidence to show this as not being a credible claim?
It's a very difficult question, because when you talk about growing any kind of tissue, you always think that you're talking of cells. And as I've told you before, enamel doesn't have any cells.
Right.
It can't regrow in a normal kind of way.
Yes.
Because the saliva comes into place here. Enamel is mineral. Saliva supplies much of the mineral. And enamels is practically built up of many so-called hydroxyapatite crystals.
Yes.
And the products, apart from Curodont, that are out there, are very good in having the damaged crystals to regrow. But what they have a problem to achieve is, once the crystal is gone completely,
Yeah.
there's no template left how to do that.
Okay.
And that's why many people say that it's not possible to regrow enamel, because where should the template come from? During the growth of the tooth, that's the amelogenin that I've mentioned before as well.
Right.
It gives the template. It makes sure that the crystals grow the way that they are. So we took a biomimic approach. We mimic nature. We supply a scaffold that arranges a certain growth of hydroxyapatite, which to all our knowledge is almost identical to hydroxyapatite, which makes up enamel. When I say this might be considered something like regrowing enamel,
Yes.
don't expect half a tooth to come back. You know, that's beyond what is possible. So we
Right.
it has been done, for example, in experiments to grow teeth, but you know, there's a very start. We're only talking about small amounts, subsurface amounts of the enamel to regenerate. It's really helping nature to do its best,
Right.
helping saliva to regenerate a little bit more than it does anyway, or to remineralize in that case, because it's all about the mineral.
So it's almost like having a plant in your backyard that needs something to climb on.
Yes,
And you build that structure, and then you train the plant to come along. And
exactly. That's absolutely how it is. You need to give it some kind of template, some
Yes.
kind of scaffold, to know where should I start forming those crystals. And that's what it does.
That's great. Dominik, would you share with us how you came to develop the product Curodont?
Sure, I'd love to tell you that story. It's been about 6 years ago. I was at a talk from a lady called Professor Jennifer Kirkham. She was telling about these self-assembling peptides, the peptides, small molecules that can build larger structures. And I was absolutely taken in by that. I'm a chemist myself. I loved the science behind it.
Yeah.
The beauty behind it, that's a little bit the geek in myself, but I was taken in by that. And she was showing some early data on what you could do on enamel with these self-assembling peptides. And that was kind of the end of the part of the story, and it took a few years. It just didn't leave me. I always came back with that, and the entrepreneur in myself kind of said, what are you waiting for? If this is the perfect product, you understand it. I was working in dentistry already before.
Yes.
I knew the market. I knew the needs of the market, at least to a certain extent. So it was absolutely, it was the product for me to become an entrepreneur. So a few years later, I went back to Jen and asked her, has anything happened, first of all? Has anybody licensed the product, the patents? That wasn't the case. So I asked her, well, would you give it to me? Would you mind me trying to develop this into a product? And she said, well, I'm fine. I'm happy if this goes further. So the University of Leeds, where Jen has her position.
That's in England.
That's in England,
right.
Yes. We have a very good collaboration, and we started, starting clinical studies, starting development. My colleague Michael joined at that point. We start to manufacture it to get all this, the details in the background. And then beginning of 2012, we got regulatory approval. In 2011, we started treating the first patients. That was still within a clinical study without, regulatory approval of the material, more development phase. And after that, after the beginning of 2012, we now start to treat patients on a regular basis. That's really the story that came along over the last 6 years. So it took a long time also for me to make this step, to really say this is the product that not only I want to do, but also I think a lot of people want.
So how many countries are using Curodont successfully now?
Well, in Europe, we have the lucky position that if you have regulatory approval within Europe, it counts for practically all European countries.
Okay.
We are launching in January 2013, or we have launched in January 2013 in Switzerland as our home market. Credentis is positioned in Switzerland. We're a Swiss company. We hope that some bigger European markets like the UK, like Germany, will follow in the course of 2013. If a dentist is really interested in using this, they can approach us. We're happy to train them on the material so that they can treat their patients with it as well. What we don't have in place in these countries is, big training schemes. That will come over the next few years.
So does it require that much training to use it?
No, actually not. It's just very different from what a dental hygienist or what a dental professional would do today.
Okay.
And that's why we need to explain to them what also the results are that they can expect. I told you before, don't expect miracles. If you have a patient with a very bad oral hygiene, it will not be a perfect dentition afterwards. You need to be realistic with your goals.
Yes.
And if you have an early caries, we can reverse and stop it. That doesn't mean that you might not see anything. It's like a little bit, you cut yourself and it heals, but you might have a scar.
Mm-hmm.
So, nothing is perfect.
Exactly.
Sometimes in very few cases, yes, we've seen perfect results, but that's not something that we can offer the patient on or give a guarantee on.
Right, and you don't want to set an expectation that will lead to disappointment.
Exactly, and that's why we like to talk with the dentists first, to have them into continuous education program, to build that in all the programs that are around, so that they know what to expect, and they also know which patients to treat with Curodont and which patients might not be suitable.
A good candidate, right.
Because, if you have a large cavity that is already painful, Curodont is surely not the right treatment, because the pain will go on and the patient will be unhappy.
Right.
And we don't want that.
Right, I agree. So to your knowledge, is there any product being used in the United States to date that's comparable to Curodont?
Well, I would say like this, development and innovation is always a stepwise approach. You see, there are products out there on which experience we build. There is fluoride, which has been established for 50 years, which is a very, very good product, which works by a different mechanism. So there is really a complementary effect.
Okay.
Not that it's it's an additive effect. Perhaps that's a better word. Fluoride works with its mechanism to harden the surface, to decrease the solubility of the enamel, and Curodont works underneath the surface.
Okay.
There are a couple of products out there that have tried that as well. Where Curodont is really unique is this building of a scaffold.
Are there any side effects to using this treatment?
No, none that we have identified so far. Of course, we've done many experiments to try to identify any kind of possible side effect. And no, we really didn't see anything so far.
How affordable will the product be for patients?
Well, I think it's affordable, but of course it's not for free. The treatment what exactly the treatment will cost is very difficult to say, because it also depends how much the dentist charges on the procedure. In Europe, the way that it's priced at the moment is that it's slightly cheaper than a small filling. Okay.
Dominik, thank you so much. I mean, this has been a really great opportunity for me to learn about it sounds like a great cutting-edge product in the field of dentistry. I cannot wait until we have access to it here in the United States. I'm happy that I was the first one you shared your great story with. And I have one last question before we wrap up, and that is, what other innovative treatments is Credentis planning for the future in dentistry, if any, at the moment?
Yeah. Well, we are trying to get more product out of the technology. You see, Credentis is built around the self-assembling technology.
Right.
So anything that we bring out will come in that direction. Of course, we think about how can we perhaps keep caries from occurring, so to have more of a preventional product, complementary to some of the other products that are out there with a different edge. So we are working on that. Ultimately, of course, we would love to provide this as a toothpaste. However, we are quite far away from doing that, and there will be not the Curodont, which can help regenerate or remineralize the tooth. It will be a prevention product, and we are working on that. Still a little bit away from that, but we're trying.
Well, thank you so much. I have really appreciated this. Anytime. Thank you for watching the Jennylyn Show. I hope that you have learned something today, that if you aren't someone who's taking care of your teeth, have learned the importance of doing that at an early stage, and will take away what you can from here and keep in touch with your dentist for when you can start to be treated by him with Curodont. Thanks to the Credentis company for sharing their story with me. Thank you and goodbye. See you next time.